Hello, Namaskar, welcome you to the SAAR Analysis. I am Chaman Nayak and here's my take. Tonight I want to ask with a question. How do we measure the progress of a society? Is it by highways? Is it by GDP growth? Is it by investment summit? Is it by industrial corridor? Or is it by something far more fundamental? Whether a mother survives childbirth. Because when a mother dies during the pregnancy or delivery, it is not merely a health statistic, it is a systematic failure. And that's what exactly why the latest MMR ratio data from the Odisha deserves our attention. Well, according to the latest data, Odisha has recorded maternal mortality ratio of 124 deaths per 1 lakh live births. Now, at first glance, this is a good news for sure. The state has achieved a remarkable reduction of 29 points, down from 153 to 124. In fact, among India's major states, Odisha has registered one of the steepest improvement in maternal mortality. But here's the uncomfortable reality no one discusses about. Despite this improvement, Odisha is still among one of the worst performing states in terms of MMR. But the latest ranking shows Uttar Pradesh rank 154, Madhya Pradesh rank 135, Chhattisgarh rank 124, Odisha rank 124 and Uttarakhand ranks is 99. While the national average currently stands approximately 87 maternal deaths per 1 lakh live births. And this is alarming. This means Odisha remains significantly above the national benchmark. So here the question arises, what explains these contradictions? How can a state improve rapidly and still remain among the worst performers? Well, the answer lies in geography of inequality. Well, the public health expert point out that Odisha has made substantial gain through higher institutional deliveries, better neonatal care, corrections of maternal anemia, and nutritional support through Anganwadi workers. Well, these interventions are working for sure. Numbers are proving it. A decade ago, Odisha's maternal mortality rate was close to 180. And today it stands in 124. This is the real progress for sure. Yet the question is, the progress is not evenly distributed. Well, the deepest challenge lies in Odisha's remote and geographically isolated area. Well, the studies conducted by the researchers from the Fakir-Mohn University highlight the persistent barriers, and the persistent barriers were: first is poor transport connectivity, delayed emergency care, limited awareness, dependence on traditional practices, geographic isolations. For many women living in the remote district, reaching a healthcare facility during the pregnancy emergency remains a race against time. And in the maternal healthcare, minutes often determines life or death. This is why Odisha's story is neither a success story nor a failure, yet the story is fast moving in the right direction for sure, yet it is not moving fast enough. But data tells the policies are working, and perhaps that is the most important lesson here. But I think development is not measured when the average improve. Development is measured when the most vulnerable improve. Well, behind every MMR statistic, there is a daughter, a wife, a mother, and a family whose future is changed forever. Well, the question before Odisha is no longer whether the improvement is possible or not. The data are already answering the fact, but the real question is, can Odisha ensure that where a woman's life no longer determine whether she survives the childbirth or not? Before I leave you tonight, here's a question for you. If economic growth is rising and the mothers are still dying in the preventable circumstances, can we truly call this development? Well, let me know in the comment section. This is the SAAR Analysis. I am Chaman Nayak. Until next time, keep questioning the headline, keep analyzing. Till then, I will be back with another episode.